and welcome to a very exciting day for the University of Pennsylvania and our partners here. Welcome to Healthy City, Healthy Women. I'm Andrea Mitchell from NBC News, but more importantly, I am Andrea Mitchell, College for Women 67, a proud alumna of the University of Pennsylvania, privileged to be a trustee of the university, and as a trustee I get the wonderful opportunity to try to support and advance all of the goals of this extraordinary institution which has such fantastic leadership. More on that in a moment. We're here today to address the increasingly complex relationship between urban living and women's health. And we're going to gather the collected wisdom today of our extraordinary School of Nursing, led by a dynamic dean, Afaf Melis, who has gathered all of us here today, members of the alumni community, our sponsors, BlackRock Women's Initiative Network, and all of our friends. In my non-Penn life, I spend a lot of quality time following Hillary Clinton around the globe. I use the term quality in a qualified sense because I can tell you something about some of those late-night flights on a military jet I don't recommend. And in fact, if not for this commitment, and who would dare to defy the dean, I would be in Rome right now covering Hillary Clinton's summit meeting with other foreign leaders. She just arrived there midnight last night, our time, and today is meeting on the subject of Libya and will be back tomorrow. Working on, of course, one of the key challenges in this extraordinary season of change in the Middle East and North Africa. But when she is not dealing with war and peace, as you know, Secretary Clinton has made women's health a vital part of her agenda as Secretary of State. There is rarely a stop anywhere that we go in the world where she does not set up a meeting with women leaders to emphasize her deeply held view that supporting women has a multiplier effect. Indeed, it is the founding principle of Vital Voices, the nonprofit organization she helped create more than a decade ago before becoming a full-time diplomat. And that really emerged out of the 1995 International Women's Conference that I was excited and privileged to cover in Beijing, where she first said that women's rights are human rights. It seems almost an article of faith to us now, but back in 1995, for a first lady, for any world leader to say that, created a storm of controversy, and not only in Beijing. It makes sense. Women are more than thought leaders. They are, in many societies, the connective tissue, literally and figuratively, between generations. Good maternal health is essential to producing healthy babies and ending cycles of disease and poverty. This becomes even more critical in congested, disease-prone urban settings. Today, you will hear from healthcare experts, from city leaders, from educators, all striving to improve urban areas and improve women's health. Our conference will be building on an academic gathering at Penn last spring that the dean convened to explore many of these same issues. Just a few bullet points to provoke further inquiry and get us all started. Experts in the emerging field of women's health cite an urban triple threat combining infectious diseases that thrive when people are crowded together, chronic, non-communicable diseases from unhealthy lifestyles, often associated with urban living. We all know the facts: tobacco use, unhealthy diets, physical inactivity. High incidence rates of accidents, of injuries, of violence and crime, especially in attack zones between home and stores or bodegas. Women in urban settings are at greater risk for compromised health, despite being largely responsible for the health of their families and their communities. In fact, women in the poorest neighborhoods have a life expectancy that is 5 years shorter than those who live in the highest income neighborhoods. Women in New York City do not receive appropriate levels of preventive care, including cancer screenings and immunizations. African American women are more than twice as likely as white women to die of pregnancy-related complications in this day and age. Globally, at least 1 in 3 women and girls is beaten or sexually abused in her lifetime. 1 out of every 6 American women has been the victim of an attempted or committed rape in their lifetimes. Despite these challenges, women perform most of the world's work. They produce most of the food. I mean, when you think about it, they perform 66.5%, I think, of the world's work, 50% of the world's food, and they earn only 10% of the income and 15% of property. Statistics show a staggering burden for women in developing countries. In Mexico, women in paid employment devote an additional 33 hours to domestic chores per week, while men's weekly contribution is only 6 hours. We know that women are uniquely influenced by the urban environments due to their gender, their role, and their sex. Often women are the gatekeepers, decision makers, and care providers for multiple generations. Educating and empowering women can have an exponential impact. Among the issues we're exploring today, access to healthy food, access to exercise, access to quality, coordinated health care, prevention of interpersonal violence. Safety and violence, in fact, and diseases like HIV/AIDS and cervical cancer that have shown increased prevalence among women, particularly in urban areas such as New York. So to lead off our conference, we are honored to have a very special woman and a very dear friend, Dr. Amy Gutmann, the president of the University of Pennsylvania, who, by the way, recently chaired the UN Colloquium of University Presidents at Penn, which focused on how the UN and universities can partner to empower women. Dr. Gutmann has made Penn the center of urban study among universities. She has made Penn a center of study of women's empowerment in all fields across disciplinary lines. She has led the way for exciting cross-disciplinary work, and much of this has been in women's health. So it is my honor to introduce my friend, our president, Amy Gutmann. Thank you all.